Abdominal pain, Wikipedia article audio. Abdominal pain, also known as a stomach ache, is a symptom associated with both non-serious and serious medical issues. Common causes of pain in the abdomen include gastroenteritis and irritable bowel syndrome. About 10% of people have a more serious underlying condition such as appendicitis, leaking or ruptured abdominal aortic aneurysm, diverticulitis, or ectopic pregnancy. In a third of cases the exact cause is unclear. Diagnostic approach. Differential diagnosis. Given that a variety of diseases can cause some form of abdominal pain, a systematic approach to examination of a person and the formulation of a differential diagnosis remains important. In order to better understand the underlying cause of abdominal pain, one can perform a thorough history and physical examination. The process of gathering a history may include: after gathering a thorough history, one should perform a physical exam in order to identify important physical signs that might clarify the diagnosis, including a cardiovascular exam, lung exam, thorough abdominal exam, and for females, a genitourinary exam. Additional investigations that can aid diagnosis include: acute abdominal pain. If diagnosis remains unclear after history, examination, and basic investigations as above, then more advanced investigations may reveal a diagnosis. Such tests include: the most frequent reasons for abdominal pain are gastroenteritis, irritable bowel syndrome, urinary tract problems, inflammation of the stomach, and constipation. In about 30% of cases, the cause is not determined. About 10% of cases have a more serious cause including gallbladder or pancreas problems, diverticulitis, appendicitis, and cancer. More common in those who are older, mesenteric ischemia and abdominal aortic aneurysms are other serious causes. Selected causes. A more extensive list includes the following. Acute abdomen can be defined as severe, persistent abdominal pain of sudden onset that is likely to require surgical intervention to treat its cause. The pain may frequently be associated with nausea and vomiting, abdominal distension, fever, and signs of shock. One of the most common conditions associated with acute abdominal pain is acute appendicitis. Location. By location, butylscopolamine is used to treat cramping abdominal pain with some success. Management. Abdominal pain is the reason about 3% of adults see their family physician. Rates of emergency department visits in the United States for abdominal pain increased 18% from 2006 through 2011. This was the largest increase out of 20 common conditions seen in the ED. The rate of ED use for nausea and vomiting also increased 18%. Epidemiology. Identifying more information about the chief complaint by eliciting a history of present illness, i.e. a narrative of the current symptoms such as the onset, location, duration, character, aggravating or relieving factors, and temporal nature of the pain. Identifying other possible factors may aid in the diagnosis of the underlying cause of abdominal pain, such as recent travel, recent contact with other ill individuals, and for females, a thorough gynecologic history, learning about the patient's past medical history, focusing on any prior issues or surgical procedures, clarifying the patient's current medication regimen, including prescriptions, over-the-counter medications, and supplements, confirming the patient's drug and food allergies. Discussing with the patient any family history of disease processes, focusing on conditions that might resemble the patient's current presentation, discussing with the patient any health-related behaviors that might make certain diagnoses more likely, reviewing the presence of non-abdominal symptoms that can further clarify the diagnostic picture. Blood tests including complete blood count, basic metabolic panel, electrolytes, liver function tests, amylase, lipase, troponin I, and for females, a serum pregnancy test, urinalysis, imaging including chest and abdominal X-rays, electrocardiogram. Computed tomography of the abdomen/pelvis, abdominal or pelvic ultrasound, endoscopy and/or colonoscopy. Gastrointestinal, GI tract, inflammatory, gastroenteritis, appendicitis, gastritis, esophagitis, diverticulitis, Crohn's disease, ulcerative colitis, microscopic colitis, obstruction, hernia, intussusception, volvulus, post-surgical adhesions, tumors, severe constipation, hemorrhoids, vascular, embolism, thrombosis, hemorrhage, sickle cell disease, abdominal angina, blood vessel compression, superior mesenteric artery syndrome, postural orthostatic tachycardia syndrome, digestive, peptic ulcer, lactose intolerance, celiac disease, food allergies. Upper middle abdominal pain, stomach, pancreas pain, duodenal ulcer, diverticulitis, appendicitis.